Hello everyone, welcome to Smiley Denti. I'm Dr. Prachi Mishra, dental surgeon. In our last video, we spoke about dental and oral facts. Today, we're going to talk about just the opposite, dental and oral myths. So, the most common myth, dental myth, is that only sweet products cause cavities, or sweet foods cause caries in your teeth, which is not true. Any carbohydrate rich or starchy food can cause dental cavities. This is because starchy food attracts bacteria, due to which bacteria multiply. Now these bacteria, they produce a certain kind of acid. This acid is what damages the teeth. So we should stay away from too much of starchy carbohydrate as well as sweet food. The next myth is that sugar-free cold drinks, we can have sugar-free cold drinks and that is not going to harm our oral cavity, our teeth. This is not true. Sugar-free cold drinks are very harmful when taken in excess because cold drinks itself, they have carbon dioxide, they are acidic, which cause tooth decay. So you don't even need bacteria for that. Itself, there is acid. The next myth is brushing for a very long time or using a hard bristled brush is better for cleaning your teeth. This is not true. The kind of brush or the kind of toothpaste doesn't really matter. It is the brushing technique which matters. And brushing for 2 minutes is enough. You don't have to brush for 4 to 5 minutes. 2 minutes is enough. Brushing twice a day is more important, and the technique, like I said, is more important. Another myth that we get caught up in is that's because of the marketing gimmicks is that toothpastes which have salt or charcoal in them are better. Maybe a red toothpaste or have a certain kind of particle, a white particle or a blue toothpaste, they are somehow better, which is not at all true. The toothpaste doesn't matter again. Of course, it should not be a tobacco toothpaste. It should be a normal fluoride toothpaste. As long as your toothpaste is a normal fluoride toothpaste, it's fine. The more important thing is your brushing technique, like I just said. Yes, of course, there are some medicated toothpaste that your dentist might prescribe, but normally you can go for a fluoride toothpaste. Another myth is that bleeding gums is normal, especially in pregnancy. People believe that if a lady is pregnant and she has a problem of bleeding or swollen gums, it's normal. That is not true. Yes, pregnancy does cause certain hormones to be produced, which can to some extent cause swelling in your gums. But that too, in those ladies who already have a bad oral hygiene or whose oral hygiene is not up to the mark or already have infection in their oral cavity. But as such, every pregnant lady does not have bleeding gums. So, if at all any lady is pregnant and she has this problem of bleeding gums, you can please go to your dentist and get a checkup done. Another myth is that if you're pregnant, you should not visit your dentist or you should not get any dental treatment done. This is not true. If you are having any toothache or any other problem in your oral cavity, please do visit your dentist. Yes, in the first trimester and in the third trimester, that is the first 3 months and the last 3 months of pregnancy, we do avoid certain dental procedures, but you can go to your dentist and take the best advice for this. Another myth is that having chewing gum is a replacement for brushing. Please don't do that. Chewing gum is just for refreshing our mouth, and that too, sugar free chewing gums. Sugary chewing gums are equally bad. Another myth that many people believe is that brushing or taking care of baby teeth is not that important. Now, baby teeth, the care of baby teeth and the type of teeth will directly have an impact on your permanent teeth. So, yes, baby teeth will fall off eventually, and we will get our everybody gets their permanent teeth, but you still do have to take care of the milk teeth. because this brushing your teeth and taking care of your oral cavity is a habit. It does not come overnight. So if the child is not trained to brush and take care of their oral cavity at a younger age, they will not do that at an older age, and obviously will have bad permanent teeth. Also, if there is a cavity, or there are caries in your baby teeth, and for some reason they have to be removed or they fall off before time, so what happens is that the permanent teeth that erupt will not erupt in the proper space. They might erupt in the wrong directions, and then later on the adult may have to go for an orthodontic treatment. That is, they might need braces. Also, what happens is that the baby teeth, they will guide the eruption of the permanent teeth. So you can understand how important they are. And if a child has a cavity in the milk tooth, chewing becomes difficult. If chewing is difficult, definitely this will have an impact on their nutrition. Um, Another important myth is that we hear lots of patients who are very reluctant to get an extraction done, even if the tooth is giving them a lot of pain, but they don't want to get it removed. Why? Because they feel that if we get it removed, this will have an impact on our eyes. This will weaken our eyesight. This is not at all true. The blood supply and nerve supply of our teeth is very different from that of our eyes. So, if at all required, and if at all your dentist advises you to get an extraction done, please listen to him or her. The next myth is that we should go to visit our dentist or go to our dentist only during an emergency. That is not true. Please don't wait for an emergency. Like we know, prevention is definitely better than cure. And why wait for a toothache? Because trust me, toothaches are very bad, and they have been regarded as the uh, second worst painful thing after delivery. So the pain that a lady faces in a delivery, and the pain that somebody faces during a toothache, these are very related. So now you know, if you haven't had a toothache, how bad a toothache pain can be. So please don't wait for that time. Visit your dentist regularly every 6 months, and that will not only improve your oral health, but definitely also improve your overall health. Like we know that, like I told you in the facts, that if your oral health is good, if your oral health is maintained, this increases your survival rate by 7 years. So yes, please keep visiting your dentist and keep brushing twice a day. Thank you so much.